Vancouver doctor has launched a crusade to bring attention to what he says is an out-of-control epidemic of HIV infections among intravenous drug users in Vancouver's downtown east side. Dr. Stan de Flaming runs a medical clinic in Blood Alley in Gastown. He sees new cases every week, and now he wants help from Premier Harcourt to bring the problem under control.
You need that high right now, and you just feel like you don't have time to go to the needle exchange or whatever, and you just I don't know, don't really care. You need to fix it bad, you'll just use anyone's needle.
And that's the problem. Sharing needles or using dirty needles is spreading HIV through Vancouver's drug-using community, and one doctor at a walk-in clinic in Gastown's Blood Alley is appealing to the government for help to stop what he's calling an unabated epidemic.
The number of positive tests coming from the injection drug-using community is greater than the number of tests positive that are coming out of the gay community.
How many HIV positive patients, new HIV positive patients, are you seeing?
I also do consultation work at St. Paul's Hospital, so between St. Paul's Hospital and my office here, I would say that perhaps 2 or 3 HIV positive patients per week in the last few months.
The nurse just came out with a form and sat down and simply said that you're positive.
That was 6 weeks ago, and Max knows how he got HIV.
I just got very depressed for about a week, and I started using quite heavily cocaine. And at one point, when I was using with some other people, and I told them that I was HIV positive, and they were quite grateful for me having told them. And we had made arrangements in the room where the safest possible procedure could be taken so there wouldn't be any confusion. But cocaine is a funny drug, and after you've used it a couple of times, it gets very confusing. And with the amount of needles that are available today, a table could be almost covered with them. And when I looked and I realized that I didn't know which one was mine. I believe that I got it from somebody who did it on purpose. I believe that there are a lot of people out there who are HIV positive who are spreading the disease out of some kind of fear that they don't want to go alone or something like that.
80% of de Vlaming's patients are IV drug users. He is so frustrated about the increase he's seen in HIV in his clinic, he's writing to the Premier and sending Harcourt a video he's made of HIV-positive patients, trying to put a human face on this disease.